Hi, my name is Aurora Sarmiento. I'm gonna be doing a adolescent well exam, um, and I'm gonna start with Miss Jimena, introducing Jimena. She's a 14-year-old female that comes for her routine well exam. Let me just sanitize myself. And let me ask you a couple of questions, okay, Miss Jimena?
Okay.
Any past medical history, Miss Jimena?
No.
Medications that you take?
No.
Do you have any allergies?
Not that I know of.
Do you use alcohol?
Mm-mm.
Drugs like vaping?
No.
Do you have a boyfriend?
No.
No. What do you do for exercise?
I'm in sports.
Which one?
I wrestle.
And you like that? How long you been
It's
doing
fun.
that?
For a year.
Miss Jimena, how's your diet?
I eat twice a day.
Twice a day? Okay. And what do you start with in the morning?
Usually eggs and fruit.
Okay. So you're incorporating vegetables in your daily intake in your food?
During lunch or dinner.
Do you drink a lot of sugary drinks?
Sometimes, not always.
No? Okay. Ms. Jimena, when you're stressed out, who do you go to?
My friends.
Who do you live with?
My mom and my brothers.
Okay. How is that? Are you, do you feel safe in your home?
I do.
Any anxiety, depression?
No.
No? Okay. And your vital signs were actually very well. Your blood pressure was 107/75, and your heart rate pretty good, 70. Respirations were 16, and your BMI is 27.4, which is total fat is just an estimate of, okay. Um, your um, your height is 5'2", and your weight was 150. Jimena, when was the last time you went to the eye doctor?
In the beginning of the year.
And your dental appointment? Do you have an appointment? When was the last time you went to the dentist?
A month ago.
A month ago. And how is that? No cavities?
No.
Good. Well, this is Ms. Jimena, 14-year-old, that comes for a routine well examination. On his assessment, patient reports being stable at home, good environment, doing well in school, doing sports, eating well, and she doesn't report any stress, any anxiety, no alcohol use, no drugs, no vaping, and no boyfriend. When was your last menstrual period?
2 weeks ago.
Okay. So I'm gonna go ahead and start with your assessment, okay? So this is, do you know who the President of the United States is?
Donald Trump.
And what year are we in, Jimena?
2026.
Who brought you here?
My mom.
Okay. Okay. Let me start with your general inspection. Okay, this is a 14-year-old adolescent, well-nourished, well-spoken, clear speech. I'm going to start with the head. Head is normal cephalic. Hair is well distributed. I don't see or feel any bumps or indentations. The skin is warm to touch and is pink. And do you have any lesions, any rashes that you want to report?
No.
I'm gonna go ahead and check your eyes, okay? I will need you to go ahead and remove your eyeglasses for me. I'm gonna shine this light in you, okay? Okay. Pupils are equal, round, reactive to light and accommodation, and extraocular movement. There's no drainage that I can see. Sclera is white, and there's no drainage on the conjunctiva is pink. I'm gonna go ahead and check your ears also, okay? There's no drainage. And it's pearly gray. And you have good cone of light. No drainage noted. Okay. I'm gonna go ahead and check your nose too, and I'm gonna ask you if you can please cover one nostril and blow out. The other one? Blow up. Good. I'm gonna go ahead and check your mouth too for any exudate, okay? Anything going on there. I'm gonna go ahead and ask you to say for me, okay? Okay. There's no exudate, tonsils or normal. No erythema noted. Gonna go ahead and check. Any pain here?
No.
Pain here?
No.
Pain here? Good. Lips are moist and pink, and no fissures, no lesions noted. I'm gonna go ahead and check and inspect your neck. Your neck is supple with no lymphadenopathy noted, with trachea is midline, okay? I'm gonna go ahead and palpate for your lymph nodes, okay? And let me know if this bothers you. Okay?
Mhm.
Can you sit up a little bit more straight? Thank you. Good. No lymphadenopathy noted, okay? I'm gonna go ahead and press on your shoulders. Can you shrug up and down? Can you turn that way for me? Can you turn that way for me? Good. Okay. I'm gonna go ahead and inspect your chest. Your chest is symmetrical. I don't see any labor breathing, no muscle retractions. I'm gonna go ahead and ask you if you can please, every time I move my stethoscope, you can take a deep breath in through your mouth, out through your mouth, please. And if you can turn that way. In, out, in, out, in, out, in, out, and in, out. Good. Good. Okay. I don't hear any wheezes. Lungs are clear bilaterally. I'm gonna go ahead and check them in the front too. No adventitious sounds heard. I'm gonna go ahead and auscultate for the heart in all 5 points. Pulmonic, second intercostal space, pulmonic, nerves point, tricuspid, and mitral. Fifth intercostal space, midclavicular. S1, S2 present. I don't hear any extra sounds. No S3, S4, no gallops. And then go ahead and belt with my belt, okay?
Mhm.
And I'm gonna start with that aortic. Pulmonic. Normal sinus rhythm with no extra sounds. I'm gonna go ahead and ask you if you can lay down, please. I'm gonna go ahead and inspect your abdomen. And the abdomen looks non-distended. Do you have any rashes that you wanna, anything that you wanna report? Okay. I'm gonna go ahead and start with auscultation, okay? I'm using the bell to just hear any thrills. And bell sounds are normal active. I'm gonna go ahead and percuss, okay? Let me know if that bothers you. I'm gonna palpate. Let me know if that hurts. Abdomen is soft, non-tender, with no masses palpated and no rebound tenderness. Okay, Miss Jimena, I'm gonna go ahead and check your pulses too here, since you're here. Okay, brachial pulses +2 bilaterally. Radial pulses. Femoral pulses. Gluteal pulses. Pedal pulses. All pulses +2 throughout upper extremities and lower extremities. I'm gonna go ahead and ask you if you can push up, push my hands, push. Good. I'm gonna go ahead and check range of motion for you, okay? Any pain there?
No.
No? Good. I'm gonna ask you if you can go ahead and go like this. Like this. Okay. Go ahead and sit down. I'm gonna ask you to remember 3 words. And I'm gonna ask you to repeat them. Later on I will ask.
Okay.
Coin, chair, and a flag.
Coin, chair, flag.
I'm gonna ask you if you can please walk heel to toe. And then heel to toe backwards. And if you can stand in front of me. Close your eyes. Okay, open your eyes. Romberg test is negative. I'm gonna ask you if you can go ahead and bend down. I'm gonna check for your back to see alignment. Lowered. A little bit lower. Good. Good. Okay. I don't see any disalignment, no kyphosis, lordosis, or scoliosis. Okay, stand up. Go ahead and sit down. If you can just tell me the 3 words that I.
Coin, chair, and flag.
Okay. I'm gonna ask you to let me see your hand and close your eyes. What number did I draw?
3.
Okay, perfect. I'm gonna go ahead and check your reflexes, okay? Good. Good. Check Achilles, okay? Good. Good. Okay. Okay, Miss Jimena. Well, we're done with your examination, okay? Everything looks good. I'm just gonna need you to come back in a year. I'm gonna need you to keep going to your dental appointments and your eye appointments. And your exam came out it's really good. Your cranial nerve 2 to 12 is grossly intact, meaning that everything's fine, okay, neurologically. And the plan is that for you, immunizations, your flu shot every year too. Any questions?
No.
No? Very good. Okay. Thank you.